Alzheimer's disease, part 2. So the question comes up, what's so hard about serving those with Alzheimer's disease? As this picture shows, it's as if there are things lurking just below the surface. One of the things we know is that as people lose their cognitive abilities, they tend to focus more on nonverbal communication, nonverbal cues, and so we have to be far more sensitive to the nonverbal cues that we're sending people. This is a depiction of a gentleman that did self-portraits during the progression of Alzheimer's disease. You can see the picture on the left is the first one that he did of himself, and as the disease progressed, you can see continuous decline, and this really reflects the perceptual disturbance that is a hallmark of Alzheimer's disease. When people lose the ability to communicate verbally, they often have to rely on nonverbal instruments. This is an example of a pain measure where people are asked to point to the face that most looks like them. So when it gets right down to it, when we treat Alzheimer's disease beyond the physical issues, what we're really treating is loneliness, helplessness, boredom, and emotional distress. Loneliness is a byproduct of changes in social relationships and resulting isolation from those changes. Helplessness often is a result of people with good intentions trying to do things for others, unfortunately sending the message that people can no longer do anything for themselves. Boredom many times is simply the result of people not being able to do the things that they used to do in life without getting some assistance or compensatory strategies. So when should people seek help? Alzheimer's disease is often thought of a family systems disease, and the ideal is to get help before it's too late. We know if people don't get help, that their own health tends to decline. This is a pretty dramatic finding. You can read here. We know that caregivers tend to use prescription drugs far more frequently to manage emotional issues as the rest of the population. And for most people there's a tipping point, and the tipping point is that point at which continuing to try to help someone without assistance begins to take such a toll on an individual's life that their own health declines. That really is the tipping point, and time to seek help. So one of the things we know is when dealing with people with Alzheimer's, people have to be educated as to how to manage behaviors that emerge, understanding that when there are perceptual disturbances, often what people most need is reassurance of their safety and that they're going to be okay. This can be accomplished first through the use of validation. Validation suggests that no matter how goofy something sounds when someone says it, we want to communicate that what they say is important, that it has meaning. And we need to understand resistance. Resistance is a form of self-protection, and for people with Alzheimer's disease, it's often sort of the last line of defense. Being able to simply just say no feels like it offers some sense of control. Control is a huge issue. One thing that can restore a sense of control is to be able to give people choices, and we're talking about simple choices. Might be as simple as, would you like me to set this glass here or here? Doesn't matter where we set the glass, but what does matter is that we're allowing someone to make a choice which gives them a sense of being in control. We do know that persuasion doesn't work very well with people who are suffering from Alzheimer's disease. In fact, it often leads to a sense of trying to be tricked and may result in more confusion and more anxiety. Medications are used occasionally to manage behaviors. Really, the only time that they're warranted is if someone is completely unresponsive to any form of redirection and is unable to sort of change a behavioral set. There are medications that can help, particularly antidepressants. So when we try to redirect someone behaviorally, we always validate the concern first, and then there's a variety of strategies that we might try. These strategies include everything from changing the subject, changing the setting, changing the person, or even being creative. If someone's very memory impaired, at times it's useful. We can make things up to get out of a tough situation, knowing that the person would be unlikely to remember what it is that we made up. So we wish with Alzheimer's disease there was a clear roadmap of always and nevers. Unfortunately, there really isn't. So oftentimes I'm asked, what are the warning signs for Alzheimer's? How do I know if I'm getting it? And it really is a whole pattern and mix of things that involves increased confusion, pretty severe memory loss, decline in judgment, language difficulties, and loss of initiative in many cases, meaning it's tough to get going and make decisions. What we know is that all adults as we age have a desire for independence, for respect, for connections. And unfortunately, often older adults are treated as recipients. And so we encourage passivity and discourage independence quite often. External continuity would suggest that even if people have Alzheimer's or other dementias, they still need to be active. They still need to be in an environment that feels good to them. They still need relationships, and they still need familiar things. So a couple of ladies that reading books is familiar. The lady on the left has Alzheimer's disease and isn't really able to read anymore, but it feels familiar sitting next to her friend and holding a book. One of the great challenges with Alzheimer's disease is dealing with the medical system and understanding all the medications and diagnoses and getting the appointments and then following directions after the appointments. Ultimately, the most important thing to remember with Alzheimer's disease is it is all about this question: what works best for whom and why? And ultimately, what we know is that with Alzheimer's care, it's driven by individualized care decisions based on the unique needs of individuals and their families. So we have to look at every individual case to determine what works best. And that lends itself to this care management style of business model where there are care managers that work with families to help them coordinate the kinds of activities and events that might work best for their loved one. And this might include some of the newer technologies and newer technology, cognitive games and things that are out there and available. So that's it for our quick slideshow. And okay.